guys, today we are having the second video for the midterm pictures label. The first picture in front of us, this is the anterior view of the abdominal wall. First of all, we can see here the skin, then we got here superficial fascia. The superficial fascia will be further divided into the Camper's and the Scarper's fascia. After that, we are coming to the muscular layer. The anteriorly, this part, the muscles cut. That's we got here rectus abdominis and the pyramidalis muscle. But anterolaterally, we are having the most externally, external oblique, then internal oblique, then transfer abdominis muscle. Then we are having the transversalis fascia and extraperitoneal fascia, then the parietal peritoneum. In this picture, the transverse section, again the same thing. After the skin, we are having the superficial fascia, which is further divided into the Camper's and the Scarper's fascia. We got here the three muscles aponeurosis, those external, internal, and transfer abdominis muscle. Okay, they are aponeurosis. That is making anterior and posterior rectus sheet around the rectus muscle. Except that we are having here extraperitoneal fascia, transversalis fascia, and extraperitoneal fascia. Transversalis fascia should be green color here, representing with it. Okay. And then we got here the parietal peritoneum, the most inner leadus line lining the internal part, which is covering here. That is the visceral peritoneum. The sagittal section, in which we can see, first of all, diaphragm. Under the diaphragm, we are having here the liver. We got here the cut part of the stomach, transfer colon, duodenum, jejunum, and ileum. This part here is the rectum, and here is the urinary bladder. What we see that the peritoneal cavity is representing this dark color and this light color. The complete peritoneal cavity divided into two parts. This dark color is representing the greater sac, and this one is representing the lesser sac, which is also known as omental bursa. Then the mesentery around the stomach, double layer, we call lesser omentum, and this one is the greater omentum. Transfer colon mesentery, transfer mesocolon, and small intestine one is the mesentery proper. Except that the structure sometime label comes. This is the pancreas, this is the aorta, and here is the vena cava, inferior vena cava. The next picture is showing the inferior view of the diaphragm. After talking about a central tendon and peripheral muscular part, we can see the lot of structure passing through. First of all, we can start from here. That is a superior epigastric artery. Then we are having the inferior vena cava. With the inferior vena cava, we are having the right phrenic nerve, and here we are having the left phrenic nerve. We got here the esophagus with the anterior and the posterior vagal trunk. And then we are having here azygos and hemiazygous vein there. We got here the aorta. From the aorta, we are having the inferior phrenic artery, left and right. And this green is representing here the thoracic duct belong to the lymphatic system. Both sides of the vertebra, we are having here paravertebral ganglion making the sympathetic trunk here. We got here the median arcuate ligament, medial arcuate ligament, and the lateral arcuate ligament of the diaphragm. The next picture is about the large intestine with its blood supply, but not complete. This is only the branches belong to the superior mesenteric artery. We can see here the vessels from here, the jejunal arteries, okay, and ileal arteries here. After that, we are having here the anterior and the posterior cecal arteries, and to the appendix appendicular artery here, this one. This one is making the loop here, that is the ileocecal artery. We got here in this part, this main one, that is a right colic artery, and this one is the middle colic artery. A very tiny small branch here, that is the inferior pancreatojejunal artery. Next picture is about the inferior view of the liver. We got here, first of all, left lobe, right lobe, caudate, and the quadrate lobe. We got here the entry exit point, what we call that porta hepatis. In the porta hepatis, we are having here the hepatic proper artery, portal vein, and the bile duct. We can also see here the cystic duct, the duct of the gallbladder. It itself is having the three parts: fundus, body, and neck. We got here fissure for the ligamentum teres, ligamentum venosum, and this one is the inferior vena cava. And this area which is not covered with the peritoneal, that is the bare area. The next one is representing the spleen, pancreas, and the part of the duodenum. But mainly it is showing our aorta, abdominal aorta. From here, the celiac trunk. And from the celiac trunk, as we can see here, is having the left gastric artery. We are having here the splenic artery, okay, which one is giving the short gastric arteries, and also here the gastromental artery, okay. On another hand, here we are having the common hepatic left gastric, okay, and on another hand, in this side that we are having here, this is place the common hepatic artery, which is later on forming the hepatic proper artery. We got here anteriorly and posteriorly the vessels around the pancreas. So this one is the gastroduodenal artery, which is going to make here anterior, and the posteriorly we got here anterior superior and posterior superior pancreatoduodenal artery. The downside here, we are having the anterior inferior and the posterior inferior pancreatoduodenal artery. The next picture is about the section of the kidney. In this section, we can see that the outer part of the kidney is the light. We call that renal cortex, which is going inside to this place, making the colon. The inner part, known as medulla, which is having the pyramid-shaped structures. We call that renal pyramids. Their apex is toward the hilum, the entry-exit point of the kidney. So this place we call that renal papilla. It is continue here with the minor calyx. Minor calyx joined together make the major calyx. and major calyx joined together make the renal pelvis, which is later on connected with the ureter. We got here renal artery and the renal vein. At the hilum here, where we can see the hollow space, that is the renal sinus. This one is representing the enteric system around the visceral tubular organs. We can start from the mucosa, submucosa, muscular layer, and serosa. We got here the plexus here. As we can see, in this place we are having the submucosal plexus. In the muscular layer, we are having the myenteric plexus. The most outerly, the serosa, actually the peritoneal layer. If it is double, then we call that mesentery. And the muscles here, we can see with the pattern that we are having the longitudinal and the circular muscles. In this picture that we can see here, this is the abdominal aorta, which is starting from the aortic hiatus and finishing in front of the L4 lumbar vertebrae, to dividing into the two terminal branches, left and the right common iliac artery. Talk about the big branches. Anteriorly, we are having the celiac trunk, superior mesenteric, and the inferior mesenteric trunk, with respectively giving the supply to the foregut, midgut, and the hindgut structures. In the middle, we are having the gonadal arteries. In the male, we call them testicular artery, and in the female, ovarian arteries. Here we go to the renal arteries on the left and right renal artery, and above that we are having here the middle suprarenal arteries, this one, except that we are having here the inferior phrenic artery, left and the right respectively, and we are having the both side four pairs, usually the lumbar arteries. In the middle here, this one is the median sacral artery, because it's going to the sacral bone. Thank you very much.